So is that working? Are we able to
Yep.
see that? Okay.
Yep. All good. And I can go over the housekeeping information. So welcome everybody. Happy you're here. We do have questions from email that we will use initially. You could put your questions into the chat too anytime during the session there. And we are planning on not finishing this until the end, so we want to get through all of your questions.
Is share still working?
No,
I to move.
no.
Okay, let
I
me,
don't know where it went.
no, I had it on my second screen and I need to have it in front of me. So let me
The
do it.
fun Mac stuff. I understand that all too well.
Yeah, let's see, that should work. Is that working now? Good deal. You
Yep,
should.
yep, yep, yep. And then
Uh,
raise your hand if you aren't really understanding what's being said, and definitely want everyone to learn and benefit from this time together. And then you could
yeah.
read the disclaimer if you'd like.
Okay, so yeah, I need to let you know we're talking about, serious medical conditions. You've had advice from your vets and you've been dispensed medication that you may or may not want to use. And I'm really not in a position to give you, specific exact information about your pet because we don't have a doctor-patient relationship. I don't have all the information, but I will do the best, so please understand the limitations inherent in this kind of a platform. And later, I am available to you by email, so we can certainly, follow up by email. I'm going to keep me busy that way. But definitely, I want to make sure that the information you get is real, is actionable, and might even be helpful, And Haley, you'll admit them now into the
Yep.
focus on this. Okay, but you're going to do the next one too, right?
Yes.
So I'll.
So we do plan on offering these for Thursday of each month at the same time. The next one is September 25th, I want to say.
It's my son's birthday.
Yes. And the sessions will be recorded live, and the recordings will be posted on the WellPet website along with our YouTube channel. Might take a day or two for me to process those. And then we do send an email as well with that recording and some other information there. So after all the questions have been answered, we'll provide 20 to 30 minutes at the end of the event where Doc will be describing in detail products that are available on the WellPet dispensary for the conditions that we are talking about tonight. We try to make those products available, in the email as well at the end. And there's a mushroom for that, which is this here, if you can see it with my blur, um, will be the reference text for these live events and for Doc's ongoing health mentoring of pet parents. And we do have the book available on Amazon. If you do purchase the book on Amazon, please email us questions at wellpethealth.com with your receipt, and we will send you a discount coupon for 25% off for two uses for anything on our WellPet website there. And we are considering offering a second live hour monthly to provide a learning experience on some popular topic, a webinar with Q&A, and then to follow that with our monthly Q&A a week or two later. So that's still in the works for us here.
And thank you, Haley. And so tonight's topic is epilepsy and neurodegenerative diseases, which epilepsy is, but we'll probably be focusing mostly on epilepsy. And and I couldn't resist in kind of making this sort of a bit teachy, a bit educational. I think epilepsy is multifaceted. It doesn't really affect each dog the same way. There's a lot of variation. There's a lot of different language. So I thought it would be good for me to kind of do a little bit of a lesson first. I apologize if it's something you're not really here for. We will get to your questions as we said, where our plan is to bop until we drop. We're not stopping until we answer every question. We want everyone to be taken care of in a way that they're comfortable with. So, and I thought that, and so I did quite a bit of work on these slides, and so I just wanted to say that this is a difficult video to watch here because it's of a dog seizuring, in a very severe way. But I thought it would be good to kind of kick it off with this, and if this is something that would be disturbing to you, I recommend, turning off your oh, Caesar is coming. That's another vet friend of mine. I would recommend turning off your video for the time being, but really for me, what this does is this really expresses to you, and maybe your dog is as severe as this, maybe it isn't, but this is a pretty severe seizure, and these are really hard to medicate, many of them, even with these strong drugs that we hate to use, you know. So I'm going to just get started and get this going. It's only like a minute long, 55 seconds, but it's pretty hard to watch. And this is from a vet website, actually. Come on, there we go. You know, the dog is totally uncontrollable. I think if we've got sound, yeah, we do. I don't know if, well, sound isn't really working, but after this involuntary motion part, the dog then starts to vocalize. And even though she's touching it and trying to comfort it, the dog is pretty much, these are pretty much uncontrollable movements on his part. And so it's a terrible thing to see. It's so that, you know, as the pet parent, you just feel totally helpless when you see this, you know, and at the same time, you know, these seizures, especially the longer they happen, the more toxic they are to the animal, and in some cases can actually kill them. So just wanted to kind of kick it off with that information. So let's start with some definitions. Um, what is a seizure? A seizure is an event where there's inappropriate nerve discharges in the brain causing involuntary movements of the limbs, like we saw, salivation, vocalization, and could be loss of urine, stool, or sometimes vomiting. Could be any of those, could be one of those, could be all of those. Each animal really charts their own specific um, uh, form of epilepsy or of a seizure based on where the problem is in their brain. And the seizures can occur very regularly or irregularly. There's no way to predict them. Um, Many times, oftentimes daily, or maybe every few months, you know, and that also, that when the frequency with which they occur as well as the severity governs whether we think it's appropriate to start with medication or not. And they can last for a few seconds. Some can last for hours. Some don't stop. That's the most toxic of all. And they can oftentimes be a one-time event related to a metabolic disturbance. Like oftentimes in these little dogs that are puppies, if they don't get enough nursing from their mom or enough food, you know, they can get hypoglycemic, which can also cause seizures. And putting a little bit of Cara syrup in their mouths can help them overcome that seizure. There could be head trauma. They could be intoxicated from something they may have eaten. A lot of different causes for it. Epilepsy, because people tend to confuse these two terms, epilepsy is the disease of the brain that causes the seizures. And again, they can recur regularly or irregularly, days or months, you know, sometimes hard to predict, sometimes very predictable. Um, and the definition of epilepsy means that there's two or more seizures at least 24 hours apart. The seizure frequency and duration, and what you start with a given animal may change over time. It may actually progress to get worse. Rarely do we see the seizures go away, but sometimes they can. I've seen some dogs that were hypothyroid, that once we got the thyroid condition corrected, their seizures went away. And then the status epilepticus. Epilepticus is what we call these continuous seizures, and they have to be stopped or they will lead to death because the brain exhausts its supply of energy and then causes death. Um, and then there's certain terms, and again, sorry to be kind of teachy about this, but I think it's good to know that. There's the latent phase of a seizure, and that's the pre-seizure activity. And once you've had a dog that has had seizures regularly, most pet parents can recognize those early signs. And in humans, they say there's like an aura, or they get an odor, or they start to see lights in their eyes, and some dogs can actually detect those the pre-seizure events in humans by how their smell, their odor. Um, we get recurrent seizures, which is the most common types in dogs. And of the whole population of dogs, it ranges from half a percentage to maybe to nearly 6% prevalence. And dogs that have greater than one seizure per year, it's really less than 1%. So even though it seems like a lot of dogs, because we have a lot of people here tonight with dogs that have seizures, when you look at the total population of dogs, it's not really super high. And then the last type of seizure is really the worst, which are what we call the refractory seizures. And of all the dogs and cats that have seizures, 30% will have it. And these are the types of seizures that you treat them with the phenobarbital, you treat them with the bromide, you treat them with all that stuff, and they still have seizures. You add the CBD, they still have seizures. You add the other things I'm going to talk about tonight, and these are really awful, because these dogs are oftentimes are walking zombies because of the sedative nature of the anticonvulsant medication, which is costly and takes its toll on the dog's body, but they still have the seizures. So there were some studies about CBD addressing refractory seizures, and we did get to see some success. So I'll talk about that and what we can do. No guarantee, they are really tough things. I don't mean to be negative. I'm just trying to be realistic. And then after the seizure, there's this post-seizure phase. It's called post-ictal. And it can be sometimes they can pace and act like they have dementia or have activity, or they may be nothing at all. And it's not really part of the seizure, but many people think of it as being the seizure as well. And one of the things that we try to figure out as a veterinarian is how long did that seizure last? Because the shorter seizures are less toxic, easier to control. The longer seizures are not. And sometimes people will tell me that that the seizure was really pretty long. And in fact, what it really was, they were also adding this post-seizure phase to the length of the seizure itself. Different types of seizures. We have what we call primary or idiopathic seizures, and that means there's no evidence that there's a genetic link or a metabolic link or toxicity or structural, it could be associated with cerebral pathology. And they can occur anywhere from 6 months to 6 years of age is typically when we see the onset of these. Interestingly enough, males have a higher risk of these than females. And the ages of 3 to 6 years is the highest risk for seizures. And these are just statistics. For some reason, higher body weights, not necessarily obesity, but that can also be a risk factor. These larger dogs seem to be at greater risk. We have generalized seizures, which the whole body's going and it's kind of symmetrical because both sides of the brain are working. But then we have focal seizures, and they're most common in cats, who also happen to salivate more, and oftentimes are sleeping and then get woken up because they have a seizure. But the focal seizures usually just occur on one side of the brain, and you kind of see, just movement, that's asymmetrical in that regards. We get acquired epilepsy. Cats get this infection, this toxoplasmosis. This is that parasite that they tell pregnant women not to clean cat boxes from because cats can poop it out and it can infect the fetus. But there can be metabolic, as I mentioned, like with hypoglycemia, or hypothyroid, and there can be toxic ingestion as well that could also lead to that. In feline epilepsy is not nearly as common as in dogs. And if there's anybody here who has a cat with epilepsy that's joined us, I'd like to hear from you. And if the acquired epilepsy, the causes of, like we just mentioned, toxoplasmosis and so on, are more common than primary. And I dug this fact up. I think it's kind of interesting that primary epilepsy in dogs is lower in the UK, 7%, 7/10 incidence, as compared to the US, which is like a 26% incidence. I wonder why. Maybe it has something to do with the food, or I don't know, because, well, the food industry is global now, and so they're feeding pretty much the same kind of crap in UK as they feed here. So, okay, so that's some definition. So when it's diagnosed, what do you do? And first, we try to rule out medical causes because medical causes oftentimes are the simplest ways of treating them, unless it's a brain tumor, which could be a cause. And early epilepsy, oftentimes we also see behavioral changes because the most common part in the brain that starts the seizures is also the part of the brain that's involved with behavior. So it's not uncommon to see behavioral changes, and then we see the onset of epilepsy. We can see metabolic changes like with Cushing's disease or hypoglycemia or diabetes or metabolic syndrome. Those are things we can address, thankfully, Cancer, maybe not so easy. Um, and we can see brain inflammation or a tumor. And we can also see like a tumor on the adrenal glands, similar to Cushing's disease, causing more of the body's steroids to be secreted or adrenaline to be produced, drugs, intoxication, head trauma. These are all the medical causes that we want to rule out, which is why when you go to talk to your veterinarian, if they know what they're doing, they'll be asking you these questions as well as doing some blood tests to try to rule them out. And hopefully the blood tests are negative. I mean, well, actually, hopefully there's a medical cause that's easy to treat. But anyway, we'll see how that turns out. And so what do we do as far as interventions? And I know that the pet parents really hate the drugs, and I don't blame you. But at the same time, I have to say that when you see a dog seizuring, like the one we saw in that video at the very beginning, you know, it's either you're going to euthanize the dog or give it a pharmaceutical. And some people choose to euthanize because of their dislike of putting it on pharmaceuticals or whatever their reasons might be. So one of the interventions we use with pharmaceuticals is we use Valium, and Valium can be given intrarectally. Thank God, these days they now have a nasal spray of Valium. The big problem with the Valium nasal spray really is that it could be abused by the pet parents. And we've actually seen that happen, especially with this opiate crisis, that people will, I mean, I've read that people actually injure their pets so they can go to the vet. So they'll dispense opiates so they can then take them. And so, although these are pretty sedating kind of pharmaceuticals, I'm not sure that only the most hardcore drug addict would fake that or take the Valium from their dog. Phenobarbital is the most common pharmaceutical to use, and it's very sedating. It's generally pretty effective, and if you can play with the dosage and do it right, you can keep the sedative nature of it down to a minimum. Potassium bromide and phenobarbital for years have been the pair that we use to treat epilepsy, and they oftentimes are heavy hammers. They can be very sedating, and that can be very daunting to the pet parent to have the dog function being like a zombie. Eventually, if we can play with the dosages properly with the dog, their liver winds up learning how to detoxify these enough that they still have the anti-epileptic function without being zombies. We've got some new drugs now. I'm familiar with Keppra and zonisamide, but I've been reading some studies, and there's a number of new drugs that we're seeing. Most of them have been borrowed from the human realm, and most of them are still not 100% effective. Each of them has their own issues with it. So, I think there's a time and a place for pharmaceuticals, and that usually is when the seizures are very frequent and they are disabling to the animal. They're affecting its quality of life. They're affecting your quality of life, and it is a choice to make. And my feeling is, as a veterinarian, that I really want to get those seizures under control and use the pharmaceuticals first if we have frequency of seizures and severity of seizures, and then we can try the alternative therapies. On the other hand, if we've got an animal who maybe seizures once a month, then I don't know that we need to start the pharmaceuticals if it's that infrequent. That's when I think it's best to use, a gentle herbal alternative type of therapy. And hopefully that can help keep the inflammation in the brain down and help regulate some of the other issues so we don't have to go to pharmaceuticals. This is why I practice what I call integrative medicine, because I don't think you want to throw the baby out with the bathwater. I think there's a real time and a place to use conventional medicine, and epilepsy can be one of those times and places to use it if it's used properly. I think too often veterinarians, medical doctors use a pretty heavy hand when they're dosing and dispensing these things. And sometimes it's important you use a heavy hand, but not always. And so you really need to treat each patient individually and work with it back and forth as far as adjusting the dosage and doing what you can to try to reduce the adverse side effects so we can get the beneficial side effects, which is the reduction of the epilepsy. So there are a lot of interventions. As I mentioned, there's pharmaceuticals, but there's other interventions as well. I wouldn't expect these interventions to work as well as pharmaceuticals or as quickly, but they could very well work well if given enough time and if the epilepsy isn't that serious. But even if the animal's on strong pharmaceuticals, there's no reason why we can't use these at the same time as the pharmaceuticals in the hope that over time, the effectiveness of these will build up so we can reduce the dosage or eliminate the pharmaceuticals. That's always the wish. That's always what you try to do. Not always possible with given individual animals, but certainly always worth a try. Now, I'm the mushroom guy these days, so I start with the mushrooms. And lion's mane is an amazing mushroom. It's a very tasty, edible mushroom, but it also has a very direct effect on the brain and on some important molecules in the brain that help the brain to repair and work better. So we don't have enough studies yet for me to be so confident to say, yeah, don't worry, lion's mane is going to work. But because of what it does, I think it's a really important mushroom to add to your program of supplements for epilepsy. And it's very easily ingested. It's very bland tasting. You can get a bulk powder and just mix it in with the food. Now, the other mushroom that's called reishi. Reishi is an amazing mushroom, and there actually are studies with reishi and epilepsy. And so I recommend that both of these mushrooms be used. Reishi is a very bitter mushroom. And it's really best taken in capsules, although there are some dogs like that bitter. I used to hate it. Now I've gotten used to it. So I take reishi in my tea every day. Um, but using these two as a combination, I think, is a good idea. And we haven't had reishi in capsules on the Well Pet dispensary since Real Mushrooms discontinued the pet-sized capsules. So we've just added the reishi caps, the larger sized capsules, which will be better, which we could use for small animals and large animals. Um, to our inventory. I don't think they're in yet. They should be in by next week. So that would be a source for you to get reishi caps of the highest quality reishi. And then, everyone talks about CBD, and there are some good studies. There's two actually good studies, and those studies are only on refractory epilepsy, on the epilepsy that keeps going even when they're on the drugs. And what they found was one study done here in Colorado at Colorado State University, my alma mater, which is a leader in research into CBD and epilepsy, and they found that a high dosage of CBD would help to reduce these breakthrough seizures. That's what we call these seizures when they're on the drugs, is breakthrough seizures. It would help to reduce that by about 30 or 40%. But they were using a pretty high dosage, and they were using about 1.5 milligrams of CBD for every pound of body weight. And that can wind up being an awful lot. It can be costly. And CBD can also, at higher dosages, if you don't gradually work your way up with it, can cause diarrhea. But one study used CBD in a full spectrum formula that had THC. They didn't do as well. I think THC can also precipitate and cause seizures in dogs. So I don't recommend using THC in dogs at all. One study had the CBDA, and CBDA is raw CBD. This is how the plant produces it. And this one study had CBD and CBDA combined, and it did very well. And the problem with CBDA is that it's very difficult the palatability sucks. So in my products, the Doc Silver Naturals, we have CBG instead. And studies show that CBDA and CBG are very comparable in their strength and their potency, but CBG is much more tasty because, you can have a really powerful formula that works, but if you can't get it into the animal, it's not going to work that way. So, so the dosages they were using were about 2 to 2.5 milligrams of CBD per kilogram, which comes out to about a milligram and a half per pound twice daily. The best way to give CBD is to mix it with a little bit of fatty food before a meal. We get the best absorption that way. You don't have to try to, get it in the mouth or rub it on their gums. They don't get as good absorption that way, and it's much easier to put it in a little bit of tasty food that they're going to like. Now, with dogs, I think that the best fatty food is actually canned cat food. I mean, there's very few dogs that are going to turn down canned cat food, but butter, cream cheese, cream, peanut butter, a hamburger, that has raw hamburgers got some fatty nature to it, are all good ways to get it in there. Makes it easier to do. So that's what I recommend, the cannabinoids and the mushrooms. And then there's dietary supplements. And we know that fish oil itself, the EPA DHA, when given at an anti-inflammatory dosage for at least 3 months, can really lower the inflammation in the body and especially in the brain. The DHA is very important for the brain. MCT oil, that's like from coconut oil, but it's been purified and it has higher levels of the important fatty acids that really do treat the epilepsy. And there's some really good studies that show MCT oil in a kibble diet really helping to reduce seizure frequency, especially in refractory seizure patients. B complex vitamins, the brain is very, very, very much likes to have the B complex up there. Vitamin D, you need to give vitamin D, but the best way to give vitamin D is you need to test the blood first so you know what level of vitamin D to give because it can be toxic at higher dosages, but it's very effective at the right dosage. And you may not know this because people, we get in the sun and our skin converts vitamin D, but dogs don't convert in the sunlight. So they're strictly their diet is strictly the only source that they can get their vitamin D from. And so if you change the diet, they're going to get a different level of vitamin D as well. So it's very important to test first and then treat according to that. And then if you make changes in the diet or add supplements that have vitamin D in it, you have to be aware of that and retest to make sure you're getting an effective dosage that's safe. And then the amino acid taurine. We know about taurine for cats. It's essential amino acid for cats. Lately, we've had issues with heart problems in dogs because of lack of taurine in pet food, because it affects the heart, it affects the eyes, but it also affects the brain. And so taurine can also help to reduce or raise the seizure threshold, so it's not as so they seizure less. And then I practice Chinese medicine for pets, and I found it to be very helpful as well. Acupuncture, you can needle points around the brain, and that have an effect of lowering raising that seizure threshold. And there's Chinese herbs, and the thing I like about Chinese medicine is that it's really very individual. You treat the patient specifically. For instance, you look at the tongue, you feel the pulses, you learn about how it reacts to heat and cold, and then based on those parameters, we could dispense the appropriate Chinese herbal formula. Like this first formula, Gentiana formula, that's for these really raging, hard to stop, very aggressive seizure activity. The Gastrodia and Uncaria, those are more for older patients, that have maybe a weakness in their liver or their kidneys, and that is a cause for it. And so that helps to support those organs. And then the last one, Dingshan Wan, that's where we have these very prolonged seizures that never seem to stop. So that's something that can be very helpful combined with everything else. Diet can also be very helpful. And recommendations are for a minimally processed low carb diet, adequate protein. And by the way, we're going to make all of these slides available to you along with the recording. So you can take photos of it, Shelley, that's fine. But this way you'll also have, there's a lot of information. It's very information dense. I don't want to overwhelm you with too much information because I do want to get to the questions, but I think this is good stuff to know about, So you need to have adequate protein, omega-3 fatty acids. This would be the dosage that we would use. Medium chain triglycerides, MCT oil. You want to manage weight. Anticonvulsants can cause increased appetite and cause weight gain. You don't want that to happen. So you have to watch how much you're feeding them. And if they become obese, it can worsen the seizure control and worsen and create drug side effects. So you want to keep that body weight lean and you want to support the healthy microbiome. And we've seen a couple of comments here where some people are doing the fecal microbiome transfer where they're giving capsules that have healthy poop in it from another dog after they've done the microbiome analysis. And from the testimony that we're hearing from a couple of the people who are participating, and maybe we can get them to talk about it a little bit. They seem to be seeing some success with that as well. So I think that's just on the horizon. It's something brand new. It looks very encouraging. And in supporting the healthy microbiome, mushrooms themselves actually have great fiber that helps to promote a healthy microbiome. Plus, they've got these beta glucans, which is a type of fiber that helps to improve immune system function in the bowel. And then also giving probiotics like the S. boulardii, which is in our daily dog and functional feline, and then also lactobacillus and bifidobacterium, which is in our RX biotic products. So, and then getting a little further into going down into the TCM a rabbit hole. Other interventions would involve food therapy using these same principles of TCM that we're using to decide where to put our acupuncture needles, or which herbal formula would be best for this particular flavor of epilepsy, in that dog. And I don't know that these would mean much to you guys. Maybe they would. But we're trying to nourish the fluids, the blood in the body. The liver is a very important player when it comes to epilepsy in Chinese medicine, so we try to address it and support it and calm it. And we try to avoid hot stimulating foods, and we try to calm the Shen with certain types of herbs. In fact, reishi, as I mentioned, is very, very powerful in terms of calming that Shen. That's probably one reason why we find reishi so effective in treating. It can be effective in as a treatment for epilepsy. So with the diet, you want to feed cooling proteins like turkey, rabbit, duck, whitefish, cod, pollock, egg white, neutral to cooling grains if you're using grains or legumes, cooling vegetables like spinach and kale, celery and cucumber. I hate kale, by the way. Zucchini, broccoli, seaweed, dandelion greens, fruits in moderation that are all cooling and yin supportive, and then sources of omega-3 like sardines and fish oil and chia seed, flax and krill. Um, and then you want to avoid warming, phlegm-forming excitatory foods like hot proteins, lamb, venison, chicken, goat, excess fatty, greasy foods. Avoid warming grains, corn, oats, and rye, and stimulants. So it'll be good to have these slides because then you can compare them to what the ingredients are in the foods you're feeding and try to select foods that are better for the condition. And we sell a TCM food on our website. It's we don't actually sell it. It's an affiliate type of thing because it arrives to your door frozen, so we can't possibly keep it in freezer. The Chi Dog does that instead, but they have a diet for epilepsy, the Wood diet, which is designed to be good for epilepsy. And there are some inconsistencies here. It's a little warming here, so it may actually also need to be adapted to the specifics of your animal. There may be another diet here, like let's say the water diet, which could be cooling and more supportive of the kidneys. But it's something to think about. And there's a lot of good information on their website. You might want to check that out. So I guess at this point, I want to talk. I wanted to talk about some products, but I don't want to talk about the products until we start doing some questions. And so we're going to save discussion of products. I think that's what I have at the end. Um, until the very end, because I don't want this to be salesy. I want this to be helpful to you in terms of medical care for your pets. So I think at this point, let's open it up for some questions. And Haley has some questions that were emailed to us already, and I think we'll start with those. But if you have some you want to put into the chat, you can. If you have trouble understanding what I'm saying, or you want to add something, or you want to say something, you just have burning desire to talk about your pet and what's going on with it, raise your hand and we'll listen to what you want to share with us.
All right, so let's see here. Are you guys able to see my screen here with these questions?
No.
Okay.
So I should stop the share on this one maybe while
Yeah,
you.
you could stop your screen share, and
Okay.
then we could bring it, or I guess we could keep it on mine, for
Yeah,
progress.
let's do that until we get to the very end of it.
Okay, perfect. All right. So, first question here. In advanced nasal cancer, 2 years from diagnosis, thanks to your products, what are neurological signs that exhibit as it progresses, and how can I best slow down and treat these neurological signs? I am noticing more twitching and body shaking, yet I don't think these are seizures, but they are new.
Right. And nasal cancer is a very aggressive disease that erodes the nasal bone as it grows. And as it approaches the brain, because it'll grow up into the brain, that's when we can start getting some of these neurologic symptoms like you're starting to see. And that's not a good sign, unfortunately. I worked with an oncologist in Michigan who had a dog that she diagnosed as having that problem, that it was starting to work its way. We call that, in the anatomy for that is the cribriform plate. And she used CBD for that. And she claimed that, she did see good results in terms of, reducing the symptoms, but we still have the growth of that cancer going that way. And probably the long-term prognosis is not that good. I'm going to be saying things that are not always, positive, but I'm just trying to be truthful about it. But I would, if you haven't tried CBD, I would go for that. And the problem with nasal cancer is that it's hard to treat surgically. They actually have to cut the nasal bone. It's awful. So they use radiation, and radiation can be very good to treat cancer because cancer cells are very sensitive to it. But unfortunately, with radiation, as with chemo, you get collateral damage, and with it in the nasal passage. And close to the eyes, not uncommon for them to go blind with it. So it's a yucky diagnosis. I'm so sorry that your dog has that. But let's try to keep them as comfortable as we can for as long as we can.
All right, next question here. Having a Chihuahua that suffers with focal seizures, who is currently taking the Silver Bullet CBD oil, should he stay on the CBD oil continuously? He's been taking it for a few months now. Should he be taking any time off from the CBD oil, and or should he increase his intake? Currently, he's on 2 drops and his focal seizures have subsided. Only one minor focal seizure in the last 2.5 months.
Well, oh, okay. Well, that's really good that you're not getting that kind of frequency. And 2 drops, and when people talk to me about how much they're giving, honestly, 2 drops, I've got two tinctures, so I don't know, and one has 4 times the potency per drop as the other. And the drops aren't always very uniform. Like if you live in a high altitude, then you're going to get a different size drop than a low altitude. So I always prefer to measure, on that dropper pipette, but it only measures as low as a quarter of an ml. And then we also base the dosing, I base the dosing because I'm a vet, on the weight as well. So, but 2 drops seems like it's working, and that's a really nice, long period of time between the focal seizures. At the same time, you know, you're getting that long distance between the focal seizures because you're giving it every day. I don't know if you're giving it twice a day. I don't know if you're giving it with food. Those would be two things to consider. 2 drops, a day doesn't, or 4 drops a day doesn't really consume a lot. I would suggest continuing it. And then if you do have, evidence of the seizures getting to start again, I would double the dosage or I would triple the dosage. There's a lot of good studies, safety studies that show that you can go really high with that dosage of CBD. It's very safe. It's been done in dogs, cats, and horses, and so we can go pretty high with that. And sometimes you need a higher dosage. So that would be my suggestion.
All right, next question. Does Doc Rob think the pet is in pain during a seizure? Are there any long-term effects from having a seizure?
Well, that's a good question, and it looks painful. It looks very uncomfortable. I don't think it's a fun thing, whether it's actually frankly painful in terms of like, arthritis pain. But I don't, and I haven't really spoken to humans that have seizures, whether it's a painful experience for them. I don't know. But whatever they're experiencing, I'm motivated to try to control that more. And then I'm sorry, the second part of that question was,
Are there any long-term effects from having a
oh,
seizure?
well, there can be, certainly, especially the more severe they are, the longer the seizure lasts, there is the possibility of the brain losing some of its oxygen content, which could cause death or, damage to the neurons in the brain. And that's where we get that status epilepticus that I was describing, that is the continuous. That's the very, very worst, and is almost always fatal unless it's stopped. And the only way we can stop it really is we use a general anesthetic agent. We put them in a coma. Like they talk about people with head trauma, put them in coma. So once you get status epilepticus, it's the the outcome is not very good. But whether they're in pain or not, we need to do everything we can to try to get those things managed and under control.
All right, next question here. Let's see. I have a bag of cordyceps that I haven't used. Would you recommend cordyceps for seizures? My 30-pound, 9-year-old neutered male Joey has experienced seizures. Unfortunately, found out that flea tick products are the source. Stopped the product 5 years ago. Last
Okay.
seizure was this spring, and the seizure before that was 1.5 years before that. Diet is homemade. Has been taking silver bullet for 3 years. 3 years, prescribed by my holistic vet, Dr. Robert Ness in Illinois.
Oh, I know, Bob. So, I think the cordyceps would be fine to use. It's my favorite mushroom. It has a variety of very interesting, effects, and one of them is that it does have a beneficial effect, on settling the brain. And all mushrooms actually do have a beneficial effect on that. But it sounds like it sounds like your things are actually doing quite well in terms of the frequency of the seizures. Yeah, these flea and tick things, they're large populations use them with no side effects, but if it affects your animal, it's pretty yucky. I don't know if he came on tonight or not, but I did get an email from a fellow whose cat had a revolution. He had two brother and sister, I guess, and they both got it, and one developed seizures and went blind. The other is completely fine. So I think, you need to show caution around them. I think heartworm disease is not a nice disease either. We need to find other ways. And I think many of these spot-on drops have a tendency to be more toxic. So really have to take it one case at a time. But so cordyceps, you've got it on hand. I would use it, but once you've consumed that, I would switch over to the lion's mane, because it is more specific for the brain. But I wouldn't waste the cordyceps. It's good stuff.
So this next question here, I think it was what you were referring to. I was giving your contact regarding CBD for my cat. In Pennsylvania, regular veterinarians cannot recommend CBD, so I am in a tough spot. My cat Tessie is 1 and started having seizures the same day she got revolution plus flea and tick. She
Yeah.
has been hospitalized, had a brain MRI, and every single test possible to rule out other causes of seizures, which were all negative. She currently takes phenobarbital, zonisamide, as well as Topamax every 12 hours and still has breakthrough seizures. She also became blind after the first seizure. I am open to adding CBD for Tessie, but for obvious reasons, I need to know if it is safe with her medications that she takes as well as how to give it. If this
Mm.
would not be safe for her, I certainly wouldn't do it. Her neurologist done a great job and she still sees him, but again, he can't comment on CBD.
Well, and I think that's so stupid. I mean, and I think they really can comment, but they just don't want to get that potential for liability. What happens is a lot of the veterinary boards in these states tell vets that there's not enough scientific evidence. It's a whole crapshoot with that. I hate that thing. It's stupid. So I connected with this guy. My heart went out to him. He showed me the picture of the cat. It's like, oh my gosh, really cute kitty cat, blind. And so yeah, we've got the cat starting on CBD and we've got the cat starting on Lion's Mane. And I hope to be able to follow that. And I hope that we can see some improvement. It may be the damage is already done. I don't know. But that's definitely something that I think is I'm glad that he posed that question, and maybe he's even with us here tonight. I doubt that he'd have enough success yet. He may just have gotten those products in the mail recently and got started. So,
All right, next question. Can you please address the use of and efficacy of CBN to help with epilepsy and calming the brain? I use a CBN CBD 4 to 1 product to help a non-epileptic dog with CCD pattern sleep at night, and it seems to help. So I'm wondering if it would help settle the brain activity of an epileptic dog better than a CBG or other CBD derivative. Thank you.
well, there really is not enough research yet about CBN, and most of it isn't very positive about the benefits, but I do keep hearing from people that they're using it and it's helping. So I'm not closed mind about that just because you don't have studies that support it. And I think because you've seen some success with it, I would continue with that product. Obviously, you like it, and I think it's worthwhile trying. So, but I don't know. I've not seen anything about CBN, and especially there's so little research in our pets, with C even with CBD or mushrooms, about epilepsy. So, case of one, I think you should try it. And why don't you get back to us and let us know so we can, because that's also a way that, when there aren't studies, having these kinds of community conversations is a good way for us to share the things that work for us that maybe isn't in print somewhere, but could help somebody else as well. And so, it's not just about me and what I want to share, but I think there's also a lot of wisdom out here in our little community that we can all benefit from.
So here is another one. At the session earlier this month, you had mentioned you were going to be doing presentations at Four Paws and PC's Pantry.
Yes.
Is that still, are you still doing that? And when, do you have any information on when that will be and what the program's topics would be?
So earlier this month, they're referring to the Q&A that I do for Real Mushrooms, because I do a Real Mushrooms every month, Q&A for Real Mushrooms, which is the third Thursday of each month, and you're all welcome to come. And then I also do this one on the fourth Thursday of each month. And yes, I'm planning on getting that to happen. Um, I've already shared with Mary at PC's Pantry products and the information I have. I need to go talk with her to see if she wants to order any and then set up a talk there. And Four Paws is also on my list. I'm sorry, I've just been so busy with stuff. Trying hard to do everything, but I'm only one person. So I am, it is on my list. In fact, I've got that list somewhere on my desktop here, but I just haven't had a chance to reach out to Four Paws yet. I did send her a copy of my book, though.
All right, so we do have some questions from the chat here. Um,
Okay.
is it important to give um, the any all meds and supplements with food to help with absorption? Are there any that should be given on an empty stomach?
I think that with with our animals, oftentimes the more important thing is how do we ensure that we can get it in them in a way that's consistent and effective? Because if the medication's not given or the supplements aren't given consistently over a long period of time, they don't work. So, the CBD, there are studies that support that it be given, with food for better absorption and better blood levels. The mushrooms, mushrooms are food, so taking them with food is not a bad thing. Um, and because mushrooms don't really have a drug-like effect, they have more like a superfood type of effect. Their benefit really is over time. My biggest concern is that if the animal is being given a really big food meal, that there's a potential that some of the more critical supplements, are just being buried in the food and may not be as well absorbed. So, I think that it's important. I think it's important to be able to give it to the animal, and if the only way to give it to the animal is with food, then by all means, that's the way to do it. If there's, and things like fish oil and B vitamins and taurine, these are all, components of food. So I think giving them with food is fine. Um, so I would say don't worry about it. Give it the easiest way possible to get the job done. I think it's still going to do the job whether you give it with food or not. But the CBD definitely with food, there's studies that support that. There's studies in horses, in people, in rats and dogs that all support that it be given that way.
All right, so we did have a couple of questions about why MCT and not coconut oil.
Because MCT oil has higher levels of C8 and C10. And the coconut oil doesn't have as high levels. It's got more of the C6 in it. So you're going to, I mean, this is what is written up in the research and the studies and everything else. The MCT oil is more effective, but I know a lot of people are very fond of coconut oil. They're bonded to it. There's companies out there that do a really good job of promoting its value. I don't think it's going to hurt, but I think that especially if you have an animal who's got a pretty nasty case of epilepsy, you want to try to get as much of the good stuff into it as you can. And MCT oil per unit volume, per tablespoon or whatever, is going to have more of the good stuff than a tablespoon of coconut oil. So that's really the concern. I don't think that there's a problem with using the coconut oil. You're just not going to have as much effectiveness. So you might have to give more.
And then this is a question about would ozone be helpful for the dog with nasal cancer?
It, Ozone is superoxygen. It's O3, and cancer cells are extremely sensitive to oxygen. It kills them. Um, and so, yes, I think that ozone could be helpful. I'm not sure at this point. It's kind of an 11th hour with this case, as far as I could tell superficially from the information. It's something that you should start some of these therapies before the cancer grows to a certain size. Because we also know with cancer that as the tumor grows, it actually develops more resistant to being treated. It develops this critical mass that just can't, that you just can't get into. It has all of these protective um, these protective mechanisms that keep it from the immune system seeing it or from drugs getting to it. So that's one reason why sometimes surgically reducing the size of the cancer, without actually curing it by the surgery can be more helpful because you've reduced the burden of the cancer. So likewise with ozone. I mean, if you've got a big mass in there, the ozone's only going to, get on the surface. It's going to maybe go into the bloodstream. I mean, certainly I would try everything, and I think that ozone's worthwhile trying. They can put ozone into the bloodstream, which would allow it to penetrate that mass better. I'm not saying don't do it. I'm not saying it's not going to work. I'm just saying I would have liked to have seen it done sooner versus later.
So there's a question here about garlic. I use garlic as part of flea tick preventative, either fresh or as springtime bug off product. Should I not do this?
This is with an animal that's seizure. An epileptic animal, I guess is the question. And
Yes.
I had garlic listed along with onions as being kind of hot spices that could precipitate it. I think it may depend on how much you're using, how much the animal's getting it. Is the garlic's topical or the garlic is internal? If the animal's seizuring and you're not having good control over the seizuring, and we know that maybe garlic could be contributing to the lack of control, can it hurt? Maybe, especially if you have fleas under control in your household, because most time fleas aren't on the pet, most of the time they're in the household, then maybe it'll be worthwhile to stop it for a while and see how it affects the seizures. Maybe they'll reduce, and maybe then in fact we know there was a garlic factor, or maybe there won't be anything. I think that, with fleas, um, treating the environment is the most important part of it versus treating the animal. And there are things like diatomaceous earth that you can sprinkle in the environment. There are these insect growth inhibitors, which only affect the insect metabolism that stop them from laying eggs and reproducing. So, those would be the ways that I would be more likely to want to address fleas, is trying to treat the environment. Now, a caveat to that, I practice in Colorado. We have like no fleas. So what I know about treating fleas is really academic because I haven't had a lot of hands-on experience doing it.
So we have a question here about capsules. So
Okay.
she has her pet on the RX Renal canine.
Okay.
And usually she will open it up, mix it in with the food. But he doesn't necessarily want to eat it as much. So she's wondering, can she wrap the capsule in meat or cheese and then give it to the dog?
Yes, absolutely. And whatever it takes to do that. Now, I think one of the most active ingredients in that RX renal is the cordyceps mushroom, which has a very strong protective effect on the kidneys. So you also might want to explore um, getting some of the cordyceps mushroom powder from real mushrooms. We sell, well, the real mushrooms powder. We sell the pouch, on the website. It's very tasty. It should be okay. There are some bitter herbs in. I designed that formula, the RX Renal, and there are some herbs that are more bitter in there, but it does have that cordyceps as well. So you might want to just look at the cordyceps itself, and try that.
So next question here, can you talk a little bit on FMT as a treatment option?
Well, FMT means fecal microbiome transfer, or something like that. And I always get the acronyms wrong. And so the microbiome, for those that are not knowledgeable about it, and most of us are just learning about it, is basically the collection of all the microorganisms in your body that live together, and really create our health. And the balance of microorganisms, and most of it's in our bowel, but we also have it in our skin and in other systems, and most of it's in our bowel. And so the balance of what they call the good bugs to the bad bugs, to kind of to put it simply, is what governs our health. And there's some interesting things. For instance, if they take feces from a person or an animal who is normally obese, and they transfer the feces, because that's what fecal microbiome transfer is taking, because there's so many organisms in the bowel. There's thousands of different organisms, and many of them are so delicate that you can't really culture them. You can't recreate them in a probiotic capsule. So we find, for instance, if you take the fecal material from a dog who is obese, and you transfer it to a dog who's thin, the dog will become obese because there's factors of the organisms that actually are creating that kind of problem in the animal. Likewise, it's possible there's what we call a brain gut connection. It kind of travels from the vagus nerve from the brain down to the bowel. And so we think that there is a connection that also relates to epilepsy. We've discovered there's a connection between the brain, the brain and the bowel. Yeah, I guess I've got shit for brains, right? But with Parkinson's disease, I mean, so it's a real thing. And so I saw a couple of testimonials with the chats as people were coming in talking about they're doing FMT with their pets that have this problem. And Marianne Brown raised her hand, and yes. And if you'd like to talk to us about it a little bit, Mary, we'd like to listen to you. So it's something that's very encouraging. Mary Kennedy, who is local to me, and she's a massage therapist, and she's been helping me with Ollie. She's been coming every other week, and her border collie Finn recently developed epilepsy, and she's a big reader. She's really on top of all the stuff, and she's had the microbiome testing, and she's getting ready to start the FMT. She's been to the neurologist. The dog's on a fairly reasonable level of phenobarbital and seems to be doing okay with that. So it is something that is brand new, and I've been tasked to teach a class on microbiome to veterinarians as far as the mushroom impact on that. So although I'm not brilliant in that area now, I will be soon. And we can maybe have a whole meeting just talking about microbiome because I think it's really fascinating. Fascinating. Miriam, would you like to say a few words? Do you, if you,
I'm happy to.
okay, please.
And actually, it's funny, not funny, but after our last meeting, I guess a month or maybe even 2 months ago, Mary Kennedy reached out to me. So
Oh,
she and I now chit chat some.
best bud.
Um, my pup was diagnosed with idiopathic epilepsy at 23 months,
Mm,
grand mal seizures, clusters, started on Keppra, then added zonisamide, then added pheno, then added potassium bromide. And
wow.
he was still having breakthrough seizures.
Right. So that's refractory
Um,
epilepsy.
Pardon?
That's refractory epilepsy.
Yeah,
Correct.
yeah, very bad. A lot of trips to the ER at night
I'm so sorry.
because I couldn't stop him. What I had at home for rescue remedies just didn't
Yeah.
even didn't put a dent in it.
Yeah. Yeah.
So fast forward, he was having him about every month, which the neurologist thought that was wonderful, and I went, no, we need to lessen these as much as we can. And Dr. Michelle Tillman,
Oh, okay. She's
yes,
down there, Stone
she's
Mountain.
my vet. Love her
Yeah, I
dear,
love her.
love her dearly.
Yeah,
Uh,
she's great.
we were trying to, after his last seizure on December 27th of 2024, his gut biome was really messed up, and we kind of pulsed some probiotics to see if that would help and a few other things, and nothing was helping. So she said, are you open to trying the FMT capsules? So it took about 3 weeks probably before I saw any improvement in
Mm,
his stool. But then after that, it got better and better. And a good side effect was he wasn't having any seizures. Now, I don't want to jinx myself,
yeah.
but he's been on the FMT since March, and his last seizure to date was December 27th. So I'm sold on it. I mean, and we use animal biome.
Yeah. They seem to be
And
the leaders right now.
pardon?
They seem to be the leaders in the field. There's another company called Legacy that I don't know much about, but I'm sure they
Yeah,
do too.
I know of some people that use the legacy too, or like the legacy, but it's very interesting because they have donor dogs, of course, that donate their poop,
Yeah.
so to speak, but it's all very controlled as far as a lot of testing are done on these
Yeah.
dogs before they can take their poop. And here, buddy, somebody's going to start talking here in a minute. There he goes. And so I feel like they do their due diligence in how they manufacture the FMT capsules.
Yeah.
He gets two every evening, and we're just on it. And thank goodness they have some good sales every once in a while because it's
Yeah, it's
it's
not cheap. Yeah.
they're not cheap. No, it's not
Yeah.
cheap. Here, bud, come here.
Yeah.
So
I know the owners of the founders of the company, and I've spent quite a bit of time with them, and they have very good integrity.
yeah.
So good for you. Good
But
for you.
it's been great. And I will add, the only other thing, of course, being on the potassium bromide, he's had experienced some ataxia and
Mm,
separation anxiety, which he's never had before. And
mm,
another Dr. Michelle thought was, she said there's a new supplement on the market called Activate that it has I could go get you don't want to wait on me to go run get the
Okay.
box,
Yeah.
but it's all supplements. It's not any prescription drugs in it, but it's different subject. And it's spelled AKAVAIT. It's usually used for older dogs that are having sundowners or some dementia, or
Okay.
and it's proven in her office, in her clinic, the older dogs have done really well on it. And she said, I have not used it on a younger dog, but do you want to try it on Miles? And so he's now into his second month of it, and his ataxia is almost
Oh, good.
non-existent,
Hmm.
and his separation anxiety is getting better. But
Did you try CBD?
oh yes, we've been on your silver bullet,
Yeah,
now
she
organic
she
silver
carries her
bullet,
stuff.
for
I'll
2
see
years.
Michelle next week. I'm
Oh,
going to
good.
the American Holistic Veterinary Medical Association conference that's going to be in Florida, so I'm sure for her it's a fairly easy trip. She
Yeah.
she recently, as you know, had a almost died from a terrible
Oh yeah.
cold. And
Oh
I'm so
yeah.
glad that she survived. But I'll
Yes.
talk with her about it. And actually the booth, I'm going to be speaking 4 hours there on mushrooms, but also exhibiting with real mushrooms. And our booth is going to be right across from the Legacy booth. So I'll get to learn a
Oh,
lot about
good.
those guys too,
Yeah.
Yeah.
She's a wonderful person
And
and a
she's huge.
wonderful veterinarian. I mean,
Yeah.
everybody in her clinic is.
Oh, yeah.
They're
And her
just
daughter,
great.
her daughter's a veterinarian now too.
Daughter and her daughter just had a second child
Oh,
a few
really?
months ago. So Dr. Michelle is a grandmother twice over.
Many blessings to her.
Yeah.
Thank you. Thank you for sharing.
No,
Appreciate it.
I'm happy to anytime. And if
Okay.
anybody on the call has any questions, I'm happy to give my email address or whatever out. So
Okay. Nice. Well, thank you again. So how are we
thank
doing with questions, Haley? How are we at? We're an hour and a quarter or so.
Yeah, I
Um,
think I
oh,
think
so let me
that's
just ask a general question here. I spent about 30 minutes, on the teachy part. Was that too much time? Was that good? I mean, it's a complicated topic and I don't want to bore people. And, I know getting to the questions is important, but I also think creating some sort of foundation of information is also important. So anybody, okay, thank you. Just wanted to know. Cool. Well, let's have some more questions. Throw them at me.
Let's see. Oh, I actually do have a couple more here. So,
Okay.
several people have mentioned seizures and issues after using flea and tick products. In Colorado, I don't use those products, but was in Georgia for a while due to family issues, and there are lots of fleas and ticks there. I tried the most benign spot-on product I could find, and he did some twitching where it was applied. I then tried rubbing him down with apple cider vinegar and water 1 to 1 before walking or spending time outside. And over the months we were there, he only got 1 tick on his foot, to which I had not applied the ACV. Have you had any experience with this or comments?
I have not had experience with apple cider vinegar. It's good to know. My advice with ticks, depending on where you are, is to just go over the animal thoroughly, with a fine-tooth comb once a day. Diseases, tick-borne diseases like Lyme's disease or Rocky Mountain spotted fever, they say it takes about 24 hours of attachment of the tick in order for that to be transferred. So if you can get to them sooner. Now, we had some ticks up here in Colorado this season, more than I normally see. And Ollie is not getting around as well, so he's laying in the bushes a lot, which is a great place for the ticks to get to him. And so I did break down and use a spot-on drop with him. I used Frontline. I think Frontline's kind of an old-time spot-on drop, and I've used it a lot in my clinic years ago. And so I used it twice on him, and that was enough for our flea season. He hasn't had any issues from that. But that's good to know that apple cider vinegar may be helpful. I think that because things may vary. It might be that in Georgia or with the tick population that you were exposed to, that was, that worked. But I think it's still, if you're going to use something that's not as certain as one of these drugs, which there are risks involved with, then I think a very close examination of your animal on a daily basis is important. With Ollie, they seem to like his head. They kind of like, a little bit inside his ear flap, or down around his neck. That seemed to be the place they liked most. They also can come, in the groin area or the armpit area. They seem to like those more than other areas.
All right, next question here. Teddy, perhaps 2.5 years, first year or two lost and alone on street, taken to shelter because he was found with injury on back of neck. We adopted him after a month at a shelter. He's a Chihuahua Dachshund mix. He started having seizures after about a month and has had one per month since. Vet says it's not the serious source, don't remember name. She prescribed phenobarbital, which I don't want to give. Now I occasionally give him a tablespoon of chamomile tea with a bit of maple syrup, my own herbs organic. I don't usually remember to give. Do you think this is helpful at all? Or would it be helpful if I remembered it more regularly?
Maybe you need some lion's mane for your memory. But yeah, there you go. So when a seizure happens once a month, and depending on the severity of the seizure when it happens, it may not be necessary to treat it with phenobarbital. I think that's kind of, a questionable frequency. As when I was in practice, I usually wanted to have them more on a weekly basis, less, more frequently than once a month. The severity also matters, and with many pet parents, just watching that helpless feeling of watching them do it, they just can't stand it. They want to give it whatever it is so it doesn't do that. Um, Chamomile, has been listed when I was doing my little research to do those slides. Chamomile came up as an herb to use, so I think that's a good choice. The maple syrup, probably what to get the chamomile down would be my guess. And maple syrup is not a bad thing. It's one of the lowest glycemic indexes as far as a sweetener would be, and they make some other sweeteners that are even less glycemic than that. There's so I don't know if you've tried CBD, when it's that frequent, when it's that infrequent. Was this your question, Shelley? Or yeah. So I don't know if you've tried CBD yet or not, but I think that might be worth a try as well. And again, maybe putting something on your calendar or something that you look at frequently as a way of jogging your memory. I also have memory issues as I am aging. I hate to admit it. And just and so you develop tools to tweak your memory. Using my phone is helpful, the computer, little notes I leave around the house. I still forget stuff, but it's better than it is without those tools. But yeah, you might want to try the CBD and we just had a sale, didn't we, Haley, on our CBD? But we also have a discount, don't we, on for things from tonight. Do you want to talk about that a little?
Yeah, absolutely. So we do have our 25% off discount, and that is site wide. That will be DRL 828. And I did put it there in the chat, but I'll throw it in there one more time for you guys. So DRL
DRL at Doc Rob Live. I get
yeah,
that.
yeah, yeah. And we do also have a buy two, get two sale going on right now for our Silver Cat chews. Silver Cat chews will have your CBD, CBG, lion's mane, cordyceps. Super tasty for cats there, but can also be used for dogs as well. So
Especially if it's a small dog.
yep, 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 yep. So you buy two pouches, you get two for free. And that discount's automatically applied if you add two of the Silver Cat chews to your cart.
Yeah, I was hoping to make a cat chew that cats would actually eat, and it's labeled for cats. It sells really poorly. We've got a lot in inventory that just aren't selling that are going to go outdated. So we're really trying to see if we can't, get people with small dogs to use it because it does have good CBD in it. It has those mushrooms as well, the lion's mane, which is good for the brain, and then the cordyceps that we mentioned. So that might, I don't know what size your critter is, but that could be a good solution. Oh, well, maybe that's a good place to go. And it's very cost effective if you're price conscious, as many of us are these days with this whole new world we live in, you know.
Yep, yep, yep. And it is a less potent version of the Silver Dog Forte chews that we do have as well. So we
Mhm.
are currently out of those. We will have those back in stock soon. But if you are looking for the silver, same chews as the Silver Dog Forte, you just have to give more of the Silver Cat chews. But we're trying to make that be available with the deal we're currently running too.
You can reach out to me, Shelley, and I'm happy to give you advice. 17 pounds Yeah, we'll figure that out. Yeah, the silver cat chews only have 2 milligrams of CBD. Oh, kitty. 2 milligrams of CBD per chew. So let me see if I can do that quickly with my little calculator. Where's my calculator? Come on. So uh, and by the way, I found out today that the Silver Dog Forte, they're going to be manufactured next week. So we're getting them back in stock, thank God. Um, so yeah, about 7 or 8 milligrams twice daily. That would be like really 4 chews twice daily. They're quite tasty, so he may just think it's a treat, you know. Um, so you might want to try like 4 chews twice daily. The packages only have 20 per package. But we're giving you a good deal, and we can probably make that even sweeter if it works for you, quite frankly. Sure. That's a cute cat, Nancy. Is that a Russian blue?
I'm not sure what he is.
Oh.
He's all
I
cat.
rescued him from the streets about 8 years ago.
Oh,
He's
well,
very sweet.
He's so
yeah,
sweet. And
cats.
Gandalf is his name. That's incredible.
Yes, and he loves to be brushed. It's his favorite thing in the world.
Oh, lucky you. Ours hate it. Yeah. So how are we doing on questions? Pretty good?
Yeah, that's all
Okay.
we have here.
Well, let's talk about some of the products. Let's do that the end part of the slideshow.
And
If
I
I can.
could if you just wanted to describe them, I can share the products themselves on my screen if that works.
Okay, I need to pull them up though on my. I don't know where they went. Find them. They're there. Okay. So yeah. So we'll start with our CBD products as we mentioned. And I combine the CBG, which is a cannabinoid like CBD, but is actually more potent than the CBD together. And we're getting really good feedback from people that it's helping with arthritis and helping with calming and helping with seizures and other problems that CBD can help with. And so we have 2 organic tinctures. We have the Silver Bullet. I kind of like playing with these names, and it's very potent. It has about 2 milligrams per drop, and 60 milligrams per ml. So it's good for big dogs. But it's also very cost effective if you're just giving a few drops at a time. It'll last you a while. Keep it in the refrigerator. Don't put the dropper in the animal's mouth or wash it off if you do. Um, but the organic sterling silver is a more entry-level tincture. It's lower potency. It has less than a milligram, about a half a milligram or more, about a half a milligram per drop. But it's the same as the silver bullet, just less potent, less expense. It's about half the cost of the silver bullet. But the silver bullet's a better deal because it's 4 times as potent as the sterling silver, even though it's only twice as expensive. The Silver Dog Forte, they were back ordered. We had some problems with our manufacturer and getting the ingredients in, but they have both the CBD and the CBG, 12 milligrams of CBD per chew, which is a pretty hefty dosage, 6 milligrams of CBG per chew, and then a pretty nice dosage of lion's mane, 500 milligrams of that, and 500 milligrams of cordyceps per chew. And I'm hoping we're going to get them back on our shelf probably a week after Labor Day, but don't quote me on it because, whenever the minute you say something like, oh, it's going to be back in stock on this date, it's not going to happen. Murphy's Law is out there. And then our Silver Cat soft chews, as I mentioned, I still haven't found that secret sauce that will get cats to eat these. And we may not do these again, or I may look for a different technology to make something for cats that will be more likely to work. But they're like the Silver Dog Forte, but they have the CBG, they have the CBD, and they have the cordyceps and lion's mane, but a lot less. And that's why you would need to give more for a 17 pound dog. But you don't have to give them with food. That's one of the things that we found from these studies is, that we get better absorption with CBD tinctures when they're given with food, but the soft chew matrix itself, that little chew treat thing, is the food. And so you get just as good absorption with the chews as you do when you add the tincture to food. Um, Right. And then mushroom products, these are all manufactured by real mushrooms. And I would just want to say, maybe guys aren't aware of it, but I have designed an awful lot of the formulas. I created them, and I created them for one company called RX Vitamins when I was with them for 25 years. That's like our Ultra EFA, which is the fish oil. And all of these mushroom products, they're mine. I've created them. So I'm really proud of that, and it's a skill I have. It's kind of like cooking, and that's one hallmark of our website that many other websites can't claim. That the owner of the website actually created those formulas. So we have the lion's mane powder. We have also caps. We got smaller caps if that's needed, but the powder is so palatable. People say it tastes a little bit like lobster. We've got those reishi caps, and that's bitter stuff. But there are some dogs that will take it, especially if you introduce it gradually. And they're 500 milligram caps, so they're good for dosing larger animals. For smaller animals, we need to figure a workaround for those guys, but I can help you with that. And then we've got these chews, relaxed mushroom chews. They're meant to be for calming. We use them a lot with thunderphobia and travel and vet visits and groomers, and they seem to work even better when you combine them with CBD. And it has the lion's mane and reishi, but it also has tryptophan, which is the serotonin precursor. Theanine is what makes green tea, gives green tea its zen, and it has calming herbs in it. Doesn't have chamomile, but I could have put it in there. It has passion flower and lemon balm and valerian root and catnip. And so because it's got catnip in it, many cats actually like this. And the chews are cool. They kind of crumble. So you can sort of crumble them into your cat's food. So that's a choice to consider. And then I have the two kind of all-in-ones. I've got the Daily Dog, which has 7 mushrooms in it. It's got the 5 Defenders plus lion's mane plus cordyceps. It has adaptogens like ashwagandha. It has active probiotics in it that are not heat sensitive. It has detoxification like milk thistle and chlorella. It's got marine lipids in the krill, and it has and antioxidants like astaxanthin, phospholipids, and seaweed. The functional feline is the same as the Daily Dog, but it's got higher cordyceps to be better adapted for the kitty cat's kidneys. And we took the seaweed out. And I meant without seaweed. That's not without seaweed, and higher cordyceps for feline kitties. Seaweed has iodine, and some cats can't tolerate the iodine if they've got hyperthyroid condition. So that's why we took that out of those. But they're very palatable. They use krill meal as the palatant, but the krill meal also provides the marine lipids, the fish oils, and the antioxidants and the astaxanthin, as well as phospholipids. And phospholipids can also be another whole category, like lecithin is a phospholipid, and it's a whole other no, another whole category of supplement that can be beneficial for seizures. And I didn't put that in the slides. It's not as important as the others, but I think I'll add those to the slides so when you do get a copy, you'll have that too. And then the Ultra EFA, that's my design of the fish oil. It has fish oil and lecithin in it already, so it's got those phospholipids, so it is good for seizures. And it's pretty potent. And basically the dosage, the anti-inflammatory dosage is a teaspoon per 20 pounds of body weight, but it takes a while to kick in. Studies show it takes about 12 weeks, 3 months to get that anti-inflammatory effect. And then nutritional support for dogs and cats. A lot of people don't know about this. This was the first product I ever formulated. It's got a lot of different green foods in it, a lot of different micronutrients and plant-based micronutrients, has some animal-based micronutrients as well in the form of liver powder, flaxseed meal, nutritional yeast, and supports general health and a shiny hair coat. And I originally designed it as a way to supplement the nutrient poor profile that we see in most forms of dry dog food, which is overly processed and considered to be an ultra processed food. RX Biotic is my blend for the lactobacillus and bifidobacterium. So using that in combination with the daily dog or functional feline gives you a really broad spectrum of probiotics that could be beneficial for the microbiome. And I didn't mention this, but vitamin D has also been shown to be very important. I did mention it though. It's very important for seizures as well as for many types of diseases. But you need to test first. And I can share with you the test that we use. It's from a company called VDI Labs. We used to carry it on the website, but you have to take it to your veterinarian to get a blood draw, and it got to be too complicated. So I guess that's it, isn't it, as far as what we're doing? Where are we? Where am I going? Oh, I see what you got. Okay, cool. Yeah. Well, nice. Nice. So, any more questions? We can stay here as long as you want.
Yeah, there is a couple of questions here on did you
Okay.
say for the CBD oil to keep it in the fridge for storage?
Well, it depends really on how rapidly you're going to use it. If you're using just a few drops from our silver bullet for your cat, it's probably best to be kept in a cool, dark place, and the refrigerator is a good place to do that. It has good shelf life at room temperature, but it depends on what your room temperature is as well. The unopened bottle is good for 2 years. So, there's nothing wrong with keeping it in the refrigerator. And if you keep it in the refrigerator, it does have these molecules in it called terpenes. And terpenes are volatile molecules. They're really what gives the aroma to marijuana, to cannabis. They're what gives the aroma also to the tincture. So it does have a very mild aroma with these terpenes. And if it's cold, then they're not as aromatic. So it also might be more it might be easier to get into the animal that way if it's cold. Refrigeration is the best way to keep it. It is, but it doesn't have to be. Next.
Yep, that's all we have
That
here.
was it. Okay.
Wait. Here's one more. Sorry. How far apart should the stasis breaker be given from the Wei Chi, right?
Booster. Give them at the same time. Don't worry about it. Give them at the same time. It's not there's no deal there. These are two Chinese herbal formulas that I use for cancer patients. The Wei Qi booster basically are herbs that support improved immune system function to help be more vigilant about the cancer. And then the stasis breaker is a formula that actually tries to break up that cancer. And we've had some very good clinicals with it. People have said that it's managed to keep the cancer at bay in their animal for a long period of time. So it's definitely worth looking at along with medicinal mushrooms, and looking at diet and high levels of fish oil if you have an animal with cancer and you're trying to manage that.
Yep, and that's all the questions we do have for tonight here.
Thank you all for coming tonight, and we'll see you. What do we have a topic for the next month?
Yes, for next month we have longevity strategies, sorry.
Okay, good. And in fact, that's one of the topics of my talk next week at the Holistic Conference is mushrooms for longevity and cognition, for lifespan and cognition. So I'll be armed with both barrels loaded for that one. Good. Well, thanks everybody. It's nice to kind of have a little community, see the same faces, and this is kind of new. And I'm looking at kind of creating some kind of a course, or maybe using recordings from these and editing them and kind of turning them into like a course or a little package or something. I don't know. I'm just trying to figure out what to do to educate people and to help the pets. So thank you all. Thanks for all the hearts. I'm starting to get in, I'm an old timer and I'm starting to kind of get into this online stuff. It's pretty cool. So good night all.